So today we will discuss the Allen test, the modified Allen test, and grading of waveforms in Allen test with plethysmography. Importance of Allen test is that it's a strong recommendation for the radial procedure. It assesses the adequacy of the palmar arch and the ulnar flow. Practically, the patient makes a fist, pushing blood from the hand. Radial and ulnar arteries are compressed and simultaneously occluded. When the hand is opened, the palm appears blanched. Release of ulnar artery should result in return of pink hand color within 8 to 10 seconds. So normally, as shown in the figure, the palm is pink, fist is made, and the radial and ulnar arteries are compressed. The hand is open and blanched after compression of both ulnar and radial arteries. The palm is pink after release of ulnar artery with radial artery occluded. So is there anything better than Allen test? More objective measurement of satisfactory ulnar flow can be documented by pulse oximetry. Using the oximeter, the pulse wave is displayed with both arteries open. So here, before radial or ulnar artery compression, pulse oximeter waveform is shown and it is normal. Waveform is flat when both radial and ulnar arteries are compressed. Pulse waveform is normal when only ulnar is released, radial is still compressed. It is called type A response. Type B response is blunted waveform and type C is flattened wave. So there are 4 grades of waveform. Barbeau classification. Type A, no change in pulse wave. Type B, damping a waveform that return to normal within 2 minutes. Type C is loss of phasic pulse waveform that return within 2 minutes. And type D is loss of pulse waveform without recovery within 2 minutes. So here is type A response, the type B response is shown, type C and type D responses of radial artery compression, the start in the A and after 2 minutes in the A and similarly in the B, C and D. The persistent damping of plethysmographic curve and a decrease of the blood oxygen saturation indicate inadequate ulnar collateral circulation. Barbeau and colleagues compared such a method with Allen test in 1010 consecutive patients. The study showed that 6.3% patients would be excluded based on the Allen test, but only 1.5% had an abnormal plethysmographic test. Although use of Allen test and grading of the results for patient selection safety concerns may not be well supported by data, in some areas this may be considered standard of community practice. In such cases, radial artery cannulation is recommended with type A and B results, can be considered with type C results and contraindicated with type D results. A reverse Allen test is done by occluding the ulnar artery and it is recommended for patients with a history of previously accessed radial artery for arterial blood gases or radial procedures. And that is the presentation for today. Thank you very much for listening.